Hi, everyone. My name is Perez, and today we're going to talk about the Flint water crisis. So, the Flint water crisis is the story of government failure, illustrating how lapses in administrative ethics and judgment can lead to mass administrative evil, or when ordinary people within their professional and administrative roles can engage in acts of evil without being aware. The Flint crisis also highlights how the application of a technical rational solution or a scientific analytic mindset can enable mass administrative evil. We will also explore how emergency managers engaged in a form of moral inversion, prioritizing financial efficiency through the application of technical rational solutions. The actors involved that failed the Flint residents were local, state, and federal agencies. The local agencies are the Flint Water Treatment Plant and the Genesee County Health Department. The state agencies are the Executive Office of the Governor, the Michigan Department of Environmental Quality, the Michigan Department of Health and Human Services, and the appointed emergency managers. The federal agency is the United States Environmental Protection Agency, and each agency failed to fulfill core responsibilities and committed administrative evil that allowed contaminated water to flow into Flint for a year and a half. So let's dive into what happened and why it was significant, highlighting key failures. A little background on Flint. Flint received its water from the Flint River until 1967 when it switched to the Detroit Water and Sewage Department to ensure an adequate water supply. Flint and the Detroit Water and Sewage Department entered into a 30-year contract that was set to expire in 2000. Following expiration, the contract would automatically renew each year unless one of the parties terminated it. And during the final years of the contract, Flint began to experience financial trouble due to a declining population, a shrinking tax base, rising labor costs, a decline in the automobile industry, and long-term financial obligations. Emergency managers played a key role in the Flint water crisis. Emergency managers represent a form of municipal takeover because they are unelected officials appointed by the state government. The appointment of emergency managers transfers power from the local governments to the state government. The appointment of an emergency manager had seen previous success in Detroit and helped the city navigate out of bankruptcy by engaging stakeholders in the decision making process. However, this was not the case in Flint. Residents were organizing in favor of changing state laws to curtail the power of emergency managers, arguing that emergency managers often ignored local concerns when making decisions. Another problem with the emergency manager system is that they are only required by law to report and be accountable to the governor. Allowing emergency managers to report only to the governor reduces government transparency and excludes stakeholders and the public from the policy-making process, as emergency managers assume responsibility for all local government functions. Flint residents' worries about the emergency manager system were realized during the Flint water crisis. Emergency managers disregarded public concern about water quality because they were not accountable to the residents, only to the governor. In Michigan and several other states, emergency managers are appointed by the state government when local governments, such as cities or school districts, face significant financial issues, including bankruptcy. In Michigan, the emergency manager laws only required emergency managers to make financial decisions. They were not required to consider matters such as public health, and they were shielded by law from liability for actions taken in official capacity. In the case of Flint, emergency managers were tasked with helping the city manage its bankruptcy, and they employed a technical, rational approach of economic efficiency, securing the cheapest water possible to save money, regardless of safety concerns. This technical rationality enabled emergency managers to commit acts of administrative evil. The actions of emergency managers in Flint are examples of moral inversion because they believed they were doing the right thing when deciding to switch water sources, as it helped alleviate the financial crisis. However, the reality is that their decisions caused a public health crisis. To reduce government costs and help Flint recover from bankruptcy, emergency managers concluded that switching Flint water sources from the Detroit Water and Sewage Department to the Carignan Water Authority would save $200 million over 20 years. The emergency managers decided to switch water sources for the city in April 2013. When the Detroit Water and Sewage Department was notified, they terminated the contract with Flint. Flint required an interim water source from April 2014 until the Carignan was completed. Emergency managers decided to use water from the Flint River, treated at the Flint Water Treatment Plant, because using Detroit Water and Sewage Department treated water in the interim was deemed too expensive. Before switching to water treated at the Flint water treatment plant, concerns had already been raised by the Michigan Department of Environmental Quality. The Michigan Department of Environmental Quality is a state agency responsible for ensuring that water systems comply with the Safe Drinking Water Act. Internal communications dating back to January 2013 indicate that the Michigan Department of Environmental Quality was concerned about the safety of Flint River water and was aware of the public health risks associated with using it. And yet they didn't interfere with the emergency manager's plan to switch to the Flint River water. They allowed Flint residents to begin using water treated at the Flint water treatment plant on a full-time basis in April 2014. This is an act of administrative evil because the Michigan Department of Environmental Quality understood the risk Flint River water posed to the public. Yet they allowed use of the Flint River due to mounting political pressure. The Michigan Department of Environmental Quality failed in its mission to provide high-quality technical assistance to localities and protect public health. They were aware of safety concerns regarding the water but remained silent, failing to alert the public. When asked by the governor to review the situation, they repeatedly downplayed the danger and provided the governor with inaccurate information. The city of Flint also played a role in committing administrative evil because Flint water treatment plant supervisors expressed concern about their readiness to begin full-time operations and their ability to meet all federal laws regarding water treatment. Yet they moved forward with water deliveries because the chosen course of the emergency managers required the use of Flint River water. This was an act of administrative evil because emergency managers prioritized financial efficiency, which necessitated the use of water treated at the Flint water treatment plant, despite its readiness concerns. The Flint water treatment plant staff complied with the order, despite knowing the plant was not prepared to deliver safe water. Soon after the switch to the Flint River, residents of Flint began to complain about the color, odor, and smell of the water. Flint water began to test positive for E. coli, total coliform bacteria, and high levels of cancer-causing chemicals. Yet the Michigan Department of Environmental Quality insisted the water was safe, disregarded public concern, and continued to inform the governor's office that the water was safe. By October 2014, General Motors has ceased using Flint water due to high chloride levels that damaged equipment. This caught the attention of the governor's office, but it didn't lead him to question his agencies, which continued to report that Flint's water was safe. Emergency managers continued to resist a switch back to the Detroit Sewage and Water Department, claiming it was too expensive to change course. Once again, emergency managers focused solely on Flint's financial problems, employing a technical, rational approach, and ignored the unfolding crisis of Flint residents being exposed to toxins in their water. The governor's lack of action is an example of administrative evil, as he received reports from state departments stating that the water was safe, while simultaneously facing public backlash and the withdrawal of major corporations due to concerns about water quality. Yet he continued to trust state agencies and empower Flint's emergency managers. The emergency manager system meant decisions about Flint's water did not go through the typical local democratic process, and emergency managers did not see themselves as accountable to Flint residents. Flint's emergency managers also did not view their job as involving securing public health and safety. One of Flint's emergency managers later stated that he was only there to handle finances, and public health wasn't part of his understanding of his job. In January 2015, it was reported that there was an increase in cases of Legionnaire's disease in Flint. Before the switch to Flint River, there were fewer than 10 cases per year. Following the switch from April 2014 to May 2015, the number of cases increased to 42. This increase was noticed by the Genesee County Health Department, which is responsible for investigating outbreaks of all reportable diseases. And yet they failed to notify the public and medical community of the outbreak until it concluded, a complete and total administrative failure. In April 2015, the Environmental Protection Agency discovered that the Michigan Department of Environmental Quality had misinterpreted the lead and copper rule, a federal law established to ensure water safety. As part of the lead and copper rule, large water systems such as the Flint water treatment plant were required to have corrosion control measures in place to prevent lead leaching into pipes. At this point, the Environmental Protection Agency knew that there was no corrosion control in place at the Flint water treatment plant. Instead of exercising its authority and immediately issuing a notice of noncompliance, the Environmental Protection Agency chose to engage in conversation with the Michigan Department of Environmental Quality. which insisted that its interpretation, which did not require corrosion control, was correct. The Environmental Protection Agency is the authority on the lead and copper rule, and its failure to enforce the rule was another act of administrative evil, because the Environmental Protection Agency employees allowed bureaucracy to prevent them from taking immediate action, even though they knew contaminated water was being delivered to Flint residents. By September 2015, independent laboratory tests by scientists confirmed high levels of lead in Flint's water, a claim previously denied by the Michigan Department of Environmental Quality. In September, a study by Hurley Medical provided irrefutable evidence that contaminated water increased the levels of lead in children in Flint. The Michigan Department of Health and Human Services is the state department responsible for monitoring lead in children through its Office of Childhood Lead Poisoning Prevention Program. It is with the Michigan Department of Health and Human Services that another act of administrative evil occurs, as our epidemiologists use epidemiological studies that showed a concerning level of lead in children compared to prior years. However, a manager trained in data analytics overrode the concern, arguing that the lead levels were inconsequential. The organizational hierarchy that allowed a manager untrained in epidemiology to disregard scientific data and continue distributing contaminated water to Flint is a result of bureaucratic chain of command that rewards obedience to orders and renders morality undesirable. Then, in October 2015, evidence from independent studies, media attention, and public backlash prompted Flint to switch its water source back to the Detroit Water and Sewage Department. Incumbent Mayor Walling was defeated by Karen Weaver, who ran on a platform to address the Flint water crisis. Following her election, she declared a state of emergency in Flint. Following her declaration, the state and federal government each declared a state of emergency, granting Flint access to state and federal aid. By the time Karen Weaver acted as a responsible administrator and declared a state of emergency, Flint had been receiving contaminated water for over a year and a half. The Flint water crisis illustrates how administrative evil can flourish in bureaucratic environments, especially when technical rational solutions are applied to public policy and emergency managers are allowed to exercise fiscal efficiency without being held accountable for the outcomes of their decisions. Administrative evil occurred at all levels of government, ranging from local to state and federal levels. It is due to the increased public pressure, media attention, and independent health agencies that administrative evil was unmasked.